Well, hello, everyone. This is Dr. Isabelle Amigues, your host of the Unabridged MD podcast. And it's such a pleasure to be here today with you all. I really hope you have a good week, and I hope you had a previous good week, and so on. Today, I want to talk about mindset because I have had a couple of patients that have really perplexed me in my career. And I wanted to share this with you so that you get some hope the next time you have to deal with your own health. So, own health issue, really. So I'm going to tell you the story. I think that I'm going to start with this. So I had a patient when I was at Columbia University. So when I repeated my fellowship, I went to New York City at Columbia University. And there was this patient that I inherited after she had seen other fellows. And she had a very complex rheumatologic condition, like extremely complex. She had nodules everywhere. There were some nodules that would not allow her to open her mouth. There were nodules in her brain, it was on the nerve, the optic nerve, so she had lost a little bit her vision. She was very young, in her 30s. And really this happened kind of like out of the blue. There was really no reason. And we biopsied everything. Actually, even before I took care of her, they had biopsied everything, like so behind on the nerve of the optic nerve. They had biopsied at the level of her jaw. And the only thing we could find was that there was inflammation. That's all, really, there was inflammation. And at first, we had called it pseudo-inflammatory tumor. And, normally those patients, they respond better to anti-inflammatory. And so she had been given an inflammatory and it seemed to work, except that it just kept coming back. And so I think I came onto her care maybe 6 years after it had started. And we started thinking, okay, well, this is really bothering her life. What can we do? And so we started a new drug, thinking, okay, well, we looked at the pathology and what we had seen, and we were like, okay, well, we cannot really pinpoint exactly what this is, but it is acting like this of a rheumatologic disorder. So let's treat it like that. And so I think we started a medication so that she would not need steroids, because she had needed so much prednisone that she was starting to develop some complication from it. And so we started this drug, an immunosuppressive drug, and it doesn't do anything, like nothing, no change at all. Kind of like the worst nightmare for a physician, right? So it doesn't do anything. And then, and I remember super clearly, I was like, well, what do you want to do? And she's like, I don't want to live like this, so please do something. So we then changed and we added a biologic agent. And maybe 2-3 weeks later, and so the goal was to decrease the other drugs, since, we didn't really know, you don't know if it's not working when you're on something, because you don't actually know if maybe the disease has progressed. So you never want to stop it, unless it's causing some side effect. You don't want to stop it like out of the blue, like cold turkey. So we decrease that drug while we're putting this other drug on her, right? And she comes with respiratory failure, so she needs to be intubated. So I can tell you, I was feeling awful, because I was like, is it me who put her? So then at first we were like, oh, she got infected and that's because of the treatment I've given her. Very rare, but can happen, right? And I was feeling really guilty. But it turns out that it had nothing to do with an infection. It was not the infection. It was literally her disease had progressed and was now involving her lungs. And it had nothing to do with the medications we had given her. In fact, if anything, maybe us giving her medication had actually slowed down the progress. But I can tell you that that moment, until we figured that out, I was not feeling great. Well, I wasn't feeling great either after, since she was not doing really good. But you're going to see why I'm talking about her as the mindset shift. So she's in the ICU, and I don't think I've ever called that many other rheumatologists in my life, because I literally called every single person that I knew that I really highly respected in our field. I talked to the NIH. I talked to French people who were specialized in autoinflammatory syndrome and fever of unknown origin. And I remember super clearly some really deep conversation with those specialists. And at one point, she was just getting worse and worse. And I remember, this is the mindset shift, guys. I go to her hospital room in the ICU. So she's intubated. So she has, it's when you're putting a tube down the lungs so that a machine can help you breathe, right? And so she cannot, because you have that, you're blocking the airway with your tube so that you can pass some air, but you're also blocking your vocal cords. So you cannot talk when you have a tube down your throat. And so she has this tube, she has a nasogastric tube. And I felt awful. I was like, wow, this young lady is here. And I really do not know how to help her. And I do not know if she was able to see almost my distress, right? But she basically writes down on a board, a whiteboard, and she's like, I trust you. I trust God. You're going to figure something out. And from there, so this is where it's so cool. From there, I was like, if she is not giving up, there is no way I will ever give up for this patient. She's not giving up. She is giving us the authorization to try something different. She could have been freaked out about the fact that we had started that other drug and she had gone into the ICU. At first, when we thought it was because of that other drug. No, in her mind, she was like, I need to get better. We need to change. I trust my doctor. I trust God. I think she trusts God. She trusts God before she trusted her doctor. No matter, it's fine, right? What's really, really cool is to see that switch of trust, because we doctors are human. And I can tell you, I felt so guilty at first because I thought it was my fault. And then I felt guilty because I was like, I'm not sure what you have. And then we started a drug. So we started a drug that is very short acting, that is safe when it comes to sepsis. And we started that. And I'm telling you, the reason we started is that she had given her approval on us trying stuff. She goes out of the ICU, so she gets extubated, I think like 3 days later, extubated. So we removed the breathing tube from her throat. Then she gets into the regular hospital room a week later. Then I think another week and she was home. Her lung nodules completely gone away. In complete remission within 3 months. And in perfect health. She actually asked me, can I be pregnant? And I'm like, please give me 1 year. Because I didn't want to rock the boat. A year later, she gets pregnant, has had, I think, several babies since, doing amazing. At that point, I'm like, I really want you to go and see the NIH. They have an undiagnosed program, and they sometimes can find what is going on. So I asked her to do that. And she goes and they're like, we still don't know what she has, but what you're doing is great. So continue to do what you're doing. So we continue to do what we were doing. She's been doing really well. And as of, a couple of years ago, she was still in full remission. The reason I share this story is that we can see how the mindset changed her outcome. I do think that if she had given up, if she was not the Pepsi person she was in, even when she was on, intubated in ICU, I don't think we would have scratched our head as much. I mean, I think I would, but you know what I mean? Like, it just gave us this opportunity to say, yes, she's fully on board. She wants this. I want to think that I would have tried to figure out what she had, no matter what her mindset was. I want to think that, and I think, yes, definitely. That said, I can tell you that there was something in me that shifted after I saw her, after I saw her trust me, after I saw her trust God. After I saw her trust her, really. Because that's really what it was. Whether you believe in God or not, it's not so much God that she believed. She believed that she was going to be okay. And that really gave me hope for her. And if that first treatment, well, the first treatment didn't work, the second treatment didn't work right before she was in the ICU, but when she was in the ICU, if that had not worked, we would have tried again and again until we would have figured out something. So it happens all of the time that sometimes we give up on our health goals. You hear me talk about remission very often on the show because I believe that in rheumatology, you can aim for remission. We have incredible treatment. And the same way that I was telling a patient recently, I was telling them, when it comes to oncology, like cancer, if your oncologist was offering you to just be better, you probably would fire them because you would be like, no, I want remission. Well, it's the same way. We aim for remission in rheumatology. And I think you have to change your mindset if you are not yet believing that you can achieve remission. You can achieve remission. You can, and you can with the help of new drugs. And you can with the help of a lot of holistic approaches that you can do for you. You can with the help of diet, like nutrition choice. You can with the help of surrounding yourself with love, less stress, and so on. And so I think that it's really important to go back to what is health for you? What does that mean? And why you want to achieve remission. And this is really important. So maybe it's like her, she wanted to have babies. She wanted to have families. That was like, that kept coming back in her care, which is why she asked us to try things even before, there was this tip over into the ICU. What does that mean? What does health means for you? And then ask yourself this question of, do you think you deserve it? And I'm going to tell you, you do. You do. Everyone deserves health. Everyone. If you think you do not, if there is any little voice in your mind that says that you do not, look really deeply at what that voice is telling you. Is it because you're getting a secondary benefit from this health issue? Is it because finally you can say no to being stressed at work? Maybe you can have an adjusted schedule. Maybe it's because your husband takes better care of you if you're sick. Maybe it's because you can tell your kids, hey, I am not ready to deal with the rambunctiousness of you right now because I'm going through this health crisis. All of this, but listen to that voice and then try to find another way. So for example, the rambunctiousness, you know what? You don't need to be sick to tell your kids like, hey, I need 1 hour of my time today. So you're going to read or you're going to watch TV for 1 hour. This is my time. You absolutely deserve that. Maybe it's work that's too stressful. Maybe it's, you're feeling guilty because you're eating a lot of meat, or maybe you're not stopping when you're eating. And so then you're having all of those complications from not eating proper nutritional things. But you know what? That's okay. Like, you also deserve sometimes to enjoy food. What is health and why can't you reach it? And then change that mindset to, yes, you deserve it. Yes, 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 you deserve it. We all deserve perfect health. We do. We all. And the good news in rheumatology is we can help you get there with our medications. We really can. We sometimes don't even need medications, but we can get you there for sure with some medications. And if you're thinking, so I know that I've triggered some people. I know because I've had some return of someone very upset about the fact that I was like, you can reach remission. And they're like, this is so awful that you're saying this. My rheumatologist doesn't think that I can reach remission. And I'm like, you know what? I don't know you. I don't take care of you. But if you're my patient, I will let you know why you can reach a remission if you have an inflammatory rheumatology condition. And I don't think I should trigger you. I think I should give you hope. And if you are thinking that it's okay for you to not be in remission, ask yourself why. Why are you holding until active disease like this? Why? And I'm not a therapist, but I can tell you that I do a lot of therapy for myself. And I always try to figure out the why. I think that they teach us a lot about who we are, and they teach us a lot about why we cannot reach certain goals that we have. Okay, I've talked a lot. So excited about this episode. I think that can really help all of us. Even for me, talking to you, it's reminding me of things that, maybe I should look into. I will see you next week. And until then, thank you so much for listening. Please leave us a review. It's really important to get the word out so that we're seen. I'm in this for the long haul. I've decided that I would do at least 10 years of this podcast. Ask me a question if you have any. And then don't hesitate to look at Rheumatology 101. I'm now doing lives much more rheumatologic related, so really specific. And I will see you next week. Take care, everyone. Bye-bye.